Dr. Ramanan, welcome to In Conversation.
Thanks for having me.
How did the situation in India get so bad so fast?
Well, India was always going to be one of those places where COVID was expected to be bad, simply because it's a dense population and all the right conditions for a respiratory virus to spread very quickly. And this was predicted back in February of last year, maybe even earlier than that. And this is the concern that led to a very early lockdown in India with just a few hundred cases. That early lockdown basically flattened the curve, at least by Indian standards, significantly all through last year. There was a peak in September, but it was not as bad as one might have expected. The system was stretched and challenged in many places, but overrun in very few places. And by the time January rolled around, the public narrative had been that India had somehow, conquered the virus, although that was not the case. I think what people forgot was that when the virus is allowed to transmit uninhibited, when people move around normally, it behaves very differently. And that's what we're seeing today. We're seeing today what the virus does when there is no lockdown. And this is the situation that one might have expected a year ago, with the health system essentially being completely overrun and unable to cope with the flood of cases.
Well, if we look, the Modi government is coming under some criticism, though, where they say that the situation has been exacerbated by large political rallies, even cricket games and religious gatherings, that more could have been done to keep those restricted, and we wouldn't have the tragic explosion in deaths and infections that we're seeing now.
This is a story that's played out all through the world, and it's unfortunately all too familiar, which is, there is always a limit on testing because people don't want the bad news to come out. It happens everywhere, in every country. Because the testing numbers are low, there's a failure to recognize that it's actually a worse infection than people may recognize. And that poor data then allows the public to make bad decisions and actually leads policymakers astray as well. They are lulled into a false sense of complacency, thinking that all is well when it is not the case. And then they open up, as has happened in India, and then the public reads that as a signal that maybe all is well, you don't have to wear a mask. The root of all of this is that if we don't have clear data and tell people what is going on, that lack of transparency is what the virus thrives on.
Is a lockdown now the answer then?
Well, India is already under lockdown in many places where cases are very high. Now, there needs to be more restrictions in places where cases are climbing. But, the thing about this virus is that wherever people sit, they always look at some other place and think, well, it's not so bad here as it is there, and so maybe we're different somehow. And this is a constant problem with many parts of the world and certainly states as well. And if these other states make the mistake of waiting too long, they too will have the kinds of scenes that we're seeing in Bangalore and Chennai and particularly in Delhi.
Well, talking about New Delhi, you're sitting there in New Delhi. Can you describe to me what's happening? What is it like when you go out the door?
Well, I don't go out the door because and I don't need to know the situation out here. I think, the smoke is in the air. All the crematoria are working overtime. There is a new crematorium with 100 pyres, which is just not too far from here, which is just opened up. And, the media is filled with what you're seeing. But more than the media, my own phone is constantly with messages about people who need oxygen. Can you get a bed here? Can I get some drugs here? This is not once in a day, it's every 2 minutes, and we're just unable to help. There are many people who are dying. I know of a young couple in their 30s who died leaving behind 2 orphan children. And literally just before I joined this interview, one of my colleagues at work, one of his nephews, who was only 21 years old, died. And these are absolutely heartbreaking. I mean, at the end of the day, it's a human tragedy, which is unfolding at a really mass scale in India, and it's utterly depressing. It's mind-numbing.
So what needs to be done?
Well, at this stage, the most immediate need is oxygen. There is oxygen supply in India, But there is no last mile connectivity. People literally have no access to it. Earlier this afternoon, I had a request from someone who was very senior bureaucrat till just couple of years ago. Him, his wife, his daughter-in-law, and his mother-in-law, all in desperate need of oxygen. And so this is not something that's available to anybody, rich or poor, at this point in time. Extremely difficult to get, and particularly getting the cylinders, getting them filled, or getting concentrators, which is why there's a huge effort underway to get people oxygen, just because it's really the cheapest intervention at this point in time to be able to save lives. But on top of that, there are drugs that are not available. There's certainly no hospital beds to be had. And of course, there are physicians who are not available, and many of them already given their lives just in the last couple of weeks to this huge upsurge in cases. But let's start with what's easiest, which is the oxygen.
So is the government right when they say there is enough medical oxygen and that it really is just a logistical question of that last mile, as you say, of getting it to people? That all of these things that are being shipped in from other countries is nice, but even that may stall if it stands there at the airport and doesn't get to a home or a hospital.
That's exactly right, Lynn. It is a last mile connectivity issue, as the government says. India does have a lot of oxygen. At any given time, only 15% of the oxygen is used for medical purposes. The rest goes to industrial purposes. And India is now diverting all of that oxygen for medical purposes. But it's just not in the places where people are. And you could be sitting in one place and there could be an oxygen plant just 50 yards from you. But if there's no way to get to you, then you're out of luck. One of the challenges which is very apparent is that a lot of people are also hoarding oxygen. They're getting a cylinder just in case something happens. And therefore, there's also an artificial shortage caused by that. And so we're trying to triage to make sure that everyone who's in actual clinical need gets it. We're also trying to make sure that hospitals get oxygen. There's a desperate shortage of supply of oxygen in hospitals. Gangaram, which is one of India's best hospitals here in Delhi, essentially lost 25 patients just a few days ago because the oxygen supply ran out. And I started Oxygen for India because a colleague of mine nearly died because they shut off the oxygen in his hospital. He was lucky to get a bed, but he couldn't get oxygen. And then they couldn't discharge him because there was no oxygen at home. And that's when I realized this is not a problem that's going to be solved by the government anytime soon.
So who can solve this?
So the Oxygen for India campaign, which is at oxygenforindia.org, is aiming to do precisely that. Basically, this is not like solving a hunger problem. This is a very specific need that is only going to be there for the next 3 months, but we have to find the system. So what we've done is rope in a bunch of companies that have specialization in procurement and logistics, in being able to operate on the ground and connections to hospitals and being able to secure medical oxygen supplies, and brought all of these folks together in just 4 days. We're trying to bring the best of the private sector and capabilities to being able to solve this last mile connectivity problem.
What can those of us who are not in India and see what's happening do?
I think all help is welcome. I think, at this stage, we just need to be able to get the concentrators and the cylinders. They're all in short supply. It takes time to get them. And then, of course, the contributions are very welcome. And I have to say that this situation in Delhi, the likes of which I have never seen in my life, and I hope to never see again, it's like a war zone, losing someone every 30 minutes. It brings out both the best and the worst in people. The worst in people is, people wanting stuff, even though they are not absolutely in desperate need, wanting a hospital bed when, their oxygen just drops to 92, and I have people at oxygen levels of 62 who need a bed. and trying to throw their weight around in their privilege. And that's the worst of humanity. But the best of humanity is that, so many people have chipped in to help, volunteers, people, running websites, trying to operate on the ground despite the enormous risk to themselves, and of course people contributing. And we already have stood up a team of 120 volunteers just, in 4 days. It's time for a powerful show of humanity, because at the end of the day, we're going to lose lives to this pandemic here, in other places as well. But if we can survive with our humanity intact, then we would have learned something for the next crisis.
What about the urban and rural infections also that are taking place? Now we're seeing some of the worst places are all in the urban centers. Then we will see people moving out, which we're beginning to see already, from the urban centers to try and escape what's happening. And will they then end up infecting all the rural areas?
Well, the infection is already in rural India. It's just not visible because there's almost no testing available there. You can barely get a test here in Delhi, forget about if you went 200 kilometers out from here. So people often ask, well, why are Maharashtra and Tamil Nadu and Andhra Pradesh and Kerala the worst affected states? They are not. They just happen to test the most, and they have strong health systems. So that applies to rural-urban divides as well. Urban India has better health systems, so it's a visible epidemic there. You can visibly see people, crowding the hospitals because there are hospitals in the first place. What will people in rural India do? There are no hospitals to crowd, and it's just going to be an invisible pandemic in rural India.
As people dying at home.
Yes.
When do you think the second wave is going to be over?
It's hard to tell because it's really endogenous. It really depends on human behavior. If we have faster shutdowns in some places where the virus is climbing, we could be out of it in as early as about 3 to 4 weeks. If that doesn't happen, and the parts of India which think that this is happening in Delhi and Bangalore, but not in their cities, and therefore are complacent, it could go on for much longer. So I would say that it really all depends on how we're responding in different parts of the country.
Horrible to think of now, but do you think that we would be seeing a third wave even when this one comes under control?
Well, a third wave is certainly not only possible, but likely given the pace of vaccination. And the only way to blunt a third wave is really to bring up vaccination coverage vastly more than where it is right now, which is going to be a challenge given the size of India. Remember, India's vaccinated about 130 million people. It's not a small number. It's just that even that number translates to only 10% of India and translates to less than 2% of people fully immunized. So it's just a numbers game, and that's really the only way out of this pandemic.
What about the whole issue of vaccination? What's going to happen now to all the big plans of vaccinating people?
Well, the vaccination campaign continues. The main challenge for vaccination is not hesitancy because everyone now wants a vaccine. It's really a supply issue. Unfortunately, India did not invest the same way that other countries did in procuring its vaccine supply. And therefore, there's a huge shortage. Vaccine eligibility is for everyone above the age of 18, but actual vaccine availability is just not there. India produces about 2.5 million doses a day, but even if it's vaccinating at 2.5 or 3 million doses a day, it will take almost another 2 years to get all the necessary people vaccinated. So the vaccination production needs to ramp up to 5 or 6 times where it is right now so that everyone in the country can be vaccinated, before the end of the year.
But it's puzzling for those of us outside of India. India has always been known as, in fact, the country that produces vaccines for the whole world. How did we get to the situation where now India needs to import the COVID-19 vaccine?
Well, keep in mind that India is good at producing vaccines for childhood, against childhood infections, and the quantum of that is much, much lower. There's probably about 120 million children born in the world every year, and 120 million children getting them vaccinated is a much smaller ask than vaccinating, 6 billion people on the planet. And that would have required India to vastly expand its vaccine production capacity, which was just not done.
What about the argument also that now we're going to get a skewing in the way that people are vaccinated? Although the government will say that everybody over 18 is eligible for the vaccine, now they're also saying that private hospitals can charge for the vaccine. Will that mean that we'll have an elite class of people who can pay for the vaccine, who get vaccinated, but then we'll have vast numbers of people who can't afford it, who won't get vaccinated because they'll be standing in queues, maybe not even a meter in distance from each other, outside a public hospital waiting for a free vaccine?
Lynn, there are two kinds of inequities. One is certainly of the kind that you're pointing out, but on the other hand, at least the higher price paid by some people could induce greater vaccine supply. So to that extent, it's helpful to have some funds on lock for the vaccine companies. The bigger problem than that is that the central government, is basically now punted to all the state governments to procure their own vaccines, something which is unimaginable, never been done in India for vaccines before. India always procures its vaccines at a central level. And what that may end up doing is inducing a competition between states to procure vaccines, in which case the wealthier states, which are all in the south, may end up getting more vaccines than the states in the north. And although income disparities in India are apparent to everyone, very few people realize that the southern states in India are much wealthier than the northern states on a per capita basis. And that also has potential to create inequity, and we have to vaccinate the entire country.
So you're saying that we may end up with a north-south divide where there will be vaccine, so to say, state nationalism, where they hoard for their own state?
Unfortunately, yes. I mean, if you leave it to the states, that's what they will do, which is try to serve their own populations. And so it skews the incentives in ways that are just not desirable.
So you think that central government purchasing ought to still be the standard, or rather that's what one should be doing, not allowing it to go to the states?
Yes, I mean, the US made this mistake, and it was a huge mistake which slowed down vaccination. Central procurement is the way to go. That's how India has always vaccinated, and India may not have the best vaccination program in the world, but given the size of the vaccination program, it had a pretty decent vaccination program.
And what about the variants that we're now seeing and the ones that people are saying are coming out of India?
So the variant story is obviously changing as we gather more evidence. And the variant story, even now, is that there are, the B1617 and the B1618, which are the so-called Indian variants, which are not scientifically linked to increased transmissibility or lethality. In other words, we can explain the second wave without needing, a lethal or a more transmissible, variant to explain that story. But that said, the clinical presentation of the disease in the second wave seems markedly different. I had not really heard of any 21-year-olds die or 30-year-olds die in the first round. There were, but not, anecdotally. And also talking to people on the ground, it seems as if we're facing quite a different situation. So something is changing in these strains for sure. And also we had evidence that breakthrough strains against the AstraZeneca vaccine were negligible based on data which are a couple of months old, but I'm not so sure anymore. We're seeing anecdotally again, not data-based, people who've been fully vaccinated, both doses. I know of a doctor who died after getting both doses and then got a COVID infection. So this is going to be a changing enemy, and that's how it works.
Have you been vaccinated?
Yes, I've had the Covaxin vaccine.
Do you feel safer this way? And would you say that to other people that no matter what, you should still get the vaccination, even though there's still a possibility you could get COVID-19 even after the vaccination?
100%. I would say to people around the world, please get vaccinated. That's really the only way in which we're going to get out of the pandemic. If you haven't been vaccinated, the risk of COVID, which is a terrible disease. I've seen people die terrible deaths in the last year, but certainly in the last 2 weeks. It's not a good way to go. And your side effects with the vaccine or your risk with the vaccine are infinitely smaller. So please get vaccinated.
If you were to look at the rest of us in Asia and you were to give us some advice about how we can all avoid having a second wave like this, what would you tell us?
Well, I have to say that your foreign minister put it very well at the beginning of the pandemic, and he said that COVID is going to be a test of three things. It's going to be a test of health systems. It's going to be a test of governance, and it's also going to be a test of people's trust and societal trust. How much people hang together and support each other. And the countries that will emerge from this relatively good shape are the ones that have all of these three things. And I have to say that that lesson from your own foreign minister is really what I'd point back to. This is an unforgiving virus. Anyone who has escaped the virus so far is mistaken to think that it will not come after them if it has the opportunity. And I think that's what we've learned in India, and that's the lesson for the rest of the world. But we need to learn from the rest of Asia on those three pillars that make sure that we keep the virus at bay.
Dr. Ramanan, thank you very much for being on In Conversation, and the very, very best of luck and good wishes from all of us here.
Thanks for having me, Lynn.